Today we are at UGHE. We are conducting a two-day trainings with the next of future healthcare providers, where we are introducing them on so many different topics regarding public health surveillance, including how to detect a disease, how to respond to a disease, how to summarize the data they have corrected in the system, how to interpret those data, and also how to disseminate the information they got for future purposes. We are equipping them with relevant knowledge required for them to be on a front line during an outbreak, not on the other way around.
I believe this program came at the right time because we recently had a Marburg outbreak and there was a lot of gaps in terms of preparedness from the healthcare workforce, and 80% of the affected cases and fatalities were from the healthcare workforce. So there was a lot of training and insights that we obtained in terms of how to identify that we have a crisis, how to be prepared and to be able to report on time, how to be able to gather the appropriate stakeholders so that we are able to control and limit and contain the outbreaks that we'll be anticipating in the future. Because Marburg might not be the last outbreak we're having, there might be other pandemics which are impending, and knowing how to be able to as a healthcare provider on the front line, how to be able to implement the infection prevention control measures, how to be able to lead the teams so that we are able to report cases as we get them, to do contact tracing, and to be able to contain the outbreak before what happened could happen again.
The most important cues and insight I've gained from this training is that, say for example, for Marburg outbreak, I was an intern doctor at Kachiru Hospital, and I remember there was a lot of fear and uncertainty in that period. But given the experience and the training I've had today, I think I'll be more or less comfortable dealing with that in terms of how I would group patients with similar symptoms and even isolate them, and also in terms of how I would report, given like the hierarchy in the hospital's communication system, and also in terms of how I would manage and advocate for more awareness and even the IPC measures.
One of the important skills that I would say I gained from this training is first to recognize outbreak. As we've seen during our internship, we met different outbreaks that we're not aware of how to manage or how to report. But with this training of HDI as well as RBC, I got to understand how to recognize a new outbreak that is coming in the country or in the region where we'll be working from, as well as to report timely and to the appropriate person. So I would say this was a good training that I learned from first recognizing the outbreaks, reporting, as well as taking the first step and taking the first action in managing the outbreaks, and immediately in that moment.
How I plan to use what I've learned today in my future career and practice is through being attentive and being open to different patients that I'll be meeting in the hospital, and learning to characterize and group similar symptoms and seeing if really the symptoms that they're having are like a usual thing or a seasonal thing, or if I'll be more suspecting of something that is unusual going on. So touching on that, I think I will be more into characterizing symptoms, and then if something like an outbreak is suspected, I'll be more comfortable in isolating and reporting and communicating even to the others so that they can stay cautious.
As a healthcare provider at the front line, and also as a doctor, you are often a leader in your teams, small teams. I'm going to make it my own responsibility to make sure that I teach my team to implement IPC measures, to identify cases, and to report on time, and to be able to advocate for the community at large for change-making initiatives so that we will not be as affected by the pandemics as before.
As a future physician, I plan to use these trainings in my everyday life while meeting the patient, encountering the patient, to take full history do a relevant physical exam to make sure that if there's any new outbreak, I'm not going to miss that. Also, secondly, I'm going to do appropriate investigations so that I could be able to rule out any new outbreak as well as to report appropriately. From this session, I learned that there are people who are trained and who take the first action in managing these outbreaks. So as a physician, if I see a patient that I could be suspecting some conditions or an outbreak, I'll be able to report that appropriately, follow up, and take necessary actions such as isolation as well as education.